Ever woken up with a painful sore in your mouth and wondered what it is? Well, you might have encountered a canker sore. These are small, shallow lesions that develop in your mouth or at the base of your gums. Unlike cold sores, canker sores don't appear on the surface of your lips and they aren't contagious. Canker sores are pretty common, so common in fact, that it's estimated that around 2 out of every 3 people will experience them at least once in their lifetime. They can be quite a nuisance, causing discomfort while eating, drinking, and even speaking. It's a topic that touches many of us, either personally or someone we know. And yet, it's surprising how little general knowledge there is about these pesky mouth ulcers. We're here to shine a light on this common, yet often misunderstood oral health issue. So stay tuned to learn more about these pesky mouth sores and how to deal with them. Now that we know what canker sores are, you might be curious about what causes them. Let's dive into that. Canker sores, those pesky little ulcers in your mouth, can be triggered by a variety of factors. Stress is a big culprit. When you're stressed, your body's immune response can go haywire, leading to these painful sores. Certain foods, especially spicy, acidic, or sharp-edged foods like chips, can also cause canker sores. Another common trigger is injury to the mouth. This could be from a dental procedure, aggressive brushing, or even accidentally biting your cheek. Lastly, vitamin deficiencies, particularly B12, iron, and folic acid, can lead to canker sores. It's important to remember that these aren't the only causes. Everyone is different, and what might trigger a canker sore in one person might not in another. While the exact cause of canker sores remains unknown, these factors are known to contribute to their occurrence. How can you tell if you have a canker sore? What are the signs to look out for? Canker sores, also known as aphthous ulcers, typically appear as small, shallow lesions on the soft tissues in your mouth or at the base of your gums. These sores can be quite painful, often making eating and talking uncomfortable. Common symptoms include a small, painful, round or oval ulcer inside the mouth, which is usually white or yellowish with a red border. You might also experience a tingling or burning sensation before the sore appears. Diagnosis is typically straightforward. A healthcare professional can usually identify a canker sore just by looking at it. No special testing is usually needed. Importantly, canker sores should not be confused with cold sores. While cold sores are contagious and usually appear outside the mouth, canker sores occur inside the mouth and are not contagious. If you experience these symptoms, it's likely you have a canker sore, but don't worry, they're usually harmless and heal on their own. So, you've got a canker sore. What can you do about it? Well, there are several ways to manage this pesky problem. Over-the-counter treatments like oral gels and rinses can provide relief by numbing the area and reducing inflammation. For severe or persistent sores, prescription medications such as corticosteroids may be the way to go. But let's not forget about home remedies. Rinsing with a solution of warm water and salt can help soothe the sore. Another option is to dab a small amount of milk of magnesia on the area a few times a day. It can serve as a protective layer and promote healing. Now, prevention. It's crucial to maintain good oral hygiene. Brush and floss daily and avoid spicy or acidic foods that can irritate your mouth. Stress management is also key, as stress can trigger canker sores. With these tips and treatments, you can manage and prevent canker sores effectively. Let's recap what we've learned about canker sores. These pesky little ulcers that pop up in your mouth are a common occurrence, and while they can be a nuisance, they're usually harmless. Causes can range from minor injuries in the mouth to certain foods, stress, or even hormonal changes. The symptoms are pretty straightforward. They start as a small, shallow, painful sore inside the mouth or at the base of the gums. Diagnosis is typically based on a simple examination. When it comes to dealing with canker sores, there are various treatment options. Over-the-counter remedies, mouth rinses, and topical products can help alleviate the discomfort. Prevention is also key. Good oral hygiene practices, a healthy diet, and managing stress can all help in keeping these annoyances at bay. Remember, canker sores are common and usually harmless, but armed with this knowledge, you can tackle them head-on when they appear.